But first, putting your heart first. Joining us right now, we are joined by Dr. Charles Campbell, who is Chief of Cardiology with UT Erlanger, to talk about an event that we have coming up this upcoming weekend. As I mentioned, putting your heart first. Let's talk in general about this particular event.
Well, we're really excited about this. This is our annual event to sort of kick off February, which is Heart Month for the American Heart Association, and we call it Heart Smart Saturday. We have 4 of our cardiologists are going to give lectures about a variety of topics, one of which is heart failure, one of which is peripheral vascular disease, sudden cardiac death, and then women in cardiovascular disease, how it affects women differently than men. These are going to be excellent lectures, and I think really informative to folks.
And one of the great things about this, we also have a healthy lunch that's included in this free program. Those specific topics, why did we choose to discuss those?
Well, these are sort of things that are a little bit outside what you might talk about with your primary care doctor. Some things that we think we can provide some expertise on, especially with respect to how heart disease affects women. Sometimes people feel like, well, it's just a disease of men.
Right.
And it's really not the case. Most of our patients are female. With respect to peripheral vascular disease, it's just really easy to ignore, and really a marker for bad things to happen to you later. So those are the kinds of things we want. And then with heart failure, it's a new epidemic. There's just lots of cases.
And of course, speaking of an epidemic here, we were talking about this before the show started. With the obesity rates in America, you're seeing younger patients, you're seeing more patients too. And this is a great thing to keep our heart as healthy as possible. Can you talk a little bit about maybe some of the increases that you are seeing and why this particular event here is really open to anybody?
It is. We want everyone to come. We're going to do EKG screening at the event, so you can get your EKG screen, get questions answered by a cardiologist. But the obesity epidemic has brought a new set of patients to us at a younger age. And we are really committed at Erlanger to making sure that we treat the epidemic at its genesis. So we're working on ways to try and make the population healthier and more active with the corporations and with Erlanger in general. So we're really excited about preventing heart disease, and that's with activity and a better diet.
And of course, folks do need to register for this event,
Correct.
But the good thing about it is free, so some good news there as well. Now, for those that maybe just think, I don't really have a history of any heart problems, I'm not, what I consider obese maybe, but you don't really ever know sometimes until the inevitable happens or something happens. For those that are out there that are maybe sort of on the fence of when they need to get checked, or, what are some of those tips that you can give somebody?
I think if you're in your 30s and you are concerned, you should come on out. If you are younger than that and have a really intense family history of heart disease, we'd love to talk to you about that too. But if you're getting into your 50s and 60s and you've never thought about this, it's time to. This is an epidemic in our society, and we want to make sure people get identified early so we can prevent this.
And I know some of the classes are maybe geared towards the adults here, but you guys actually have a pediatric wing that helps out with a lot of our youth as well for maybe some problems that are different than obesity, but still even,
We do. We have
obesity.
Excellent pediatric cardiologists in the Erlanger system, and they're ready to see folks and help them with these problems.
And what sets aside the cardiac unit there at Erlanger from everyone else, I guess?
We're an academic program, so we're teaching the next generation of doctors. We're providing a lot of innovation. We provide very meticulous care, and so we think we're on to something with this sort of academic approach.
And of course, we have a lot of ladies that watch this show here, and you mentioned too that we sort of kind of ignore that this is maybe not a problem in women's health; it's more of men's health here. But those that maybe are watching, what do you tell some of the young ladies that are out there?
Don't ignore
what do they need
your
to look out
symptoms.
for?
Don't ignore symptoms. Chest discomfort, intense shortness of breath. Please come and get it evaluated. One of the things I notice is that folks will insist that the male in their life get in, and then they'll ignore their own symptoms. And sometimes nausea and vomiting are more prevalent among females. So please just come on in and get it checked.
And of course, sometimes education is the best tool
That's
as
right.
well too. So again, we want to make sure that folks understand that they do need to register for this free event that's going to be taking place on Saturday. It's going to be down there at Chattanooga State.
Correct, off of Amicola Road.
All right, there it is, the information. It is at Chattanooga State Health Science Center. It's going to be taking place again January 31st from 9 a.m. until 1 p.m. The event is absolutely free, and they'll throw in a healthy lunch as well. What's a healthy lunch? What are you having?
Fruits and vegetables.
That's a healthy lunch. All right, 423-778-5465 is the phone number for more information. Of course, you can also go to the website, which is erlanger.org/HeartSmartSaturday. Good way to take care of ourselves. We appreciate you coming on.
My pleasure.
Good to meet you
Thank
as well.
you.
Thank you. All right, folks.